All right, so we're back here today with Destan, and today we're talking about annual wellness visits. So, what are some things that people can expect with their annual wellness visit? Question I get a lot. In fact, I would say one of the things that I get a lot from people is that they don't want to go to the annual wellness visit because there are things that they don't want to happen. And so, why don't we start instead of things to expect, things not to expect from your annual wellness visit that typically scare people away from it. The first thing I can think of is most people don't want certain exams.
Right.
Guys, there are certain exams that they really want to avoid. And for a lot of those exams these days, really we can do those with blood work without having to do a full exam that keep people away. Sometimes I get from people in academic centers that go, no, you have to do this and this and this. But quite honestly, just after 20 years, what I have found is if people are afraid to come in to get it done, they're not going to come in and get it done. And it's far better to do the blood work than it is to have somebody not come get anything done. One of the things I can tell you, just having a wife and children, that women really do not look forward to are pap smears.
This is true. And so typically, during annual wellness exams, if they want us to do pap smears, we absolutely can. There are two females in the clinic, both me and Lauren, who are both fully capable of doing pap smears, but we can also leave that to be managed by your gynecologist, and that's absolutely acceptable.
Yeah, I think as well, the older I get, I can remember looking back, and there were things like pap smears that it did not matter. Women got them every year from the time they were 19 to the time they were 99. Mm-hmm. And that's really not true anymore.
Right. And so now I think typically it's like every 3 to 5 years, and you age out at a certain age where you're excluded from those pap smears and you no longer have to have those done.
Yeah. And so that's some of the things that I think people are the most scared about. Certainly prostate exams, pap smears are the two things that I typically find that most people are the most resistant to when it comes to yearly. And most of that can be done in other modalities rather than how it was done 20 years ago. Mm-hmm. And so one of the things that I think is really important as we look at pap smears, mammograms, things like that, is we do want to screen for cancer. Right? We want to be sure that in an annual wellness visit that we're avoiding missing any diagnosis of mm-hmm. cancer. And so one of the things that I think people should be able to expect is that their annual wellness visit should be tailored to them. Mm-hmm. It's not a one-size-fits-all.
Right. And I think another thing that a lot of people get concerned about when it comes to annual wellness visits, and this is your specialty, is a colonoscopy. A lot of people don't want to do those anymore. They don't like the idea of them. They don't like the prep for whatever reason. But there are other ways that we can, screen the colon now. One of those being with Cologuard, where you just get sent something and you send back what you need to send back. We get a result from it and go from there.
Yeah, I think being sure that people get what they need, right, but they also get it in a way that is comfortable for them is really mm-hmm. important. And also just being sure that based off how old somebody is, right, and what we really want to do is to tailor their care plan, right, for screening for, especially for cancers, tailor it for what their risks are for certain cancers. Mm-hmm. And I think that has actually reduced the amount of screenings that we've had to do overall that are just sort of blanket, and allows us to take really a more targeted approach to somebody to look and see what is their risk for things like a colon cancer or a breast cancer or prostate cancer, instead of just taking a cookie cutter and everybody who comes in gets all the same treatment, being sure that people get a very personalized treatment plan.
Absolutely.
So the other thing, right, we talked about cancer prevention, is the other big killer of people in the United States is cardiovascular disease. Mm-hmm. And so that's the other thing that we particularly want to try to do, is to prevent cardiovascular disease, as opposed to waiting until after somebody's had a heart attack. And so just talk to us a little bit about some of the things that we're doing here, as well as that really any general internist should be doing to screen for cardiovascular disease.
We do all the lab work, so CBC, CMP, those things check just like your blood count, chemistry panel. We do lipid profile to check your cholesterol levels, and any of the other labs that we need to do.
So, and one of the reasons the lipid profile is so important, right, is when we look at the different types of cholesterol, we don't want to just look at a total cholesterol. You like to look at the breakdown, and different components of that really push towards plaque formation or not. We've through the years have changed some of our theories on how plaques form, but cholesterol is still a really big key to that. But one of the other keys that we also screen for is blood sugar, right? And we're learning that interaction between blood sugar and cholesterol is really important as well in plaque formation, and developing things like heart disease or strokes or other issues.
Absolutely.
So we talked about cardiovascular disease with blood work, but also just from physical exam, right? Like, our blood pressure, and why keeping our blood pressure well controlled is so important. Would be one of the other screenings that we do that you can not necessarily have to come to the doctor to get, but it is one of those things that while we're plugging everything into a formula to go, what's your risk, right, of developing heart disease, and how do we keep that risk as low as we possibly can?
Yeah. And I think the other important thing about blood pressure too is not only can it lead to heart disease, but it can also lead to other things, like damaging your kidneys, eyesight, stuff like that. And we want to prevent those things from happening. And so that's why annual wellness visits are super important, because we're tracking those blood pressures over the years, and we can kind of track them in a way that we start to learn what your normal blood pressure is. And once it starts to get out of your norm, we can quickly correct it before it leads to more damaging of other organ systems in the body.
Yeah. That's probably the two biggest things, right? Cancer screening and trying to prevent heart disease and strokes. But there are other things that also play into the annual wellness visit, from being sure that people get their vaccinations. It's a really controversial subject after COVID. But also being sure that we're tailoring that right for what people are comfortable with, because some people are more comfortable, some people are less comfortable with vaccines these days, and being sure that you have a good relationship with your provider and with the providers with their patients, so that we're able to really customize that for the person, as opposed to just a one cookie cutter fits everything.
And I think that's something that our team does well here. If you want vaccines, we absolutely can order them. We're on board for it. But if you don't want them, I think we're all pretty non-judgmental and from that standpoint. And kind of base everything off of not only what the patient wants, but what's best for them as well.
And I think as well, that we're always going to recommend the things that we think are good and important. But in the end, our patients get to make those choices, right? And,
absolutely.
And I think that whenever you get to a place where we're having to dictate what patients are doing, medicine's gone way too far at that point, from that standpoint.
Absolutely.
So good plugs here for annual wellness visits and for preventive maintenance. If you have any questions, just be sure to let us know.